Hello, welcome to this video highlighting the services and programs available through Health and Counseling Services at Eastern Illinois University. Health and Counseling Services at Eastern Illinois University is comprised of 4 functional units. Our medical clinic, where our students can access convenient medical care from providers, nurses, our lab, X-ray, and pharmacy. Our counseling clinic, where students can seek counseling and therapy for a wide variety of issues ranging from anxiety, depression, academic stresses, relationship issues, transitions, and trauma. Our student insurance program, which offers a supplemental insurance policy intended to complement a student's primary insurance. And our Health Education Resource Center, our Health Promotion and Education Unit, which provides a wide variety of services, programs, and activities for outreach, education, and skill development. This is our life's work. As you can see by our staff listing, we have a wide and varied staff ranging from medical doctors, nurse practitioners, nurses, pharmacy staff, counselors, health educators, billing and coding specialist, administrative staff, all who have chosen to work in the college setting because we value and appreciate the students that we work with, and we know that our work and our efforts help them be academically successful in their pursuits here at Eastern Illinois University. New students coming in, as well as returning students, are required to submit immunizations to the university as a result of the Illinois College Immunization Act. The Act actually says that students who are taking 6 or more hours of on-campus classes are required to show proof of various immunizations, including measles, mumps, and rubella, diphtheria, tetanus, and pertussis. And for those students under 22, the need to show proof of being vaccinated against meningitis A and C, and having a second vaccine on or after their 16th birthday. Again, this is a state requirement that the state is typically audited on, and as a result, those students who have not shown verification and compliance by the 11th day of the semester will have an academic hold placed on their accounts. Students who still have not submitted records that have met compliance by 30 days after the start of the semester will be charged a $35 non-compliance charge. For students who need immunizations, we do offer such immunizations through the medical clinic. However, many students may find it more cost-effective to use their primary insurance and get their shots at home prior to coming to campus or going off campus to one of the nearby pharmacies which offer vaccinations. In addition to immunization records, there are 3 different distinct online health education courses that students are required to complete before the first day of class. One is Alcohol EDU for College Primary, which will take our students approximately 2 to 3 hours. Sexual Assault Prevention for Undergrads, which will take approximately 1 to 2 hours. And Mental Wellbeing for Students, which will take approximately 1 hour. All 3 of these courses are available online and will be available approximately July 20th through July 25th, 2020. Again, for our fall students, these are due by the first day of class of the fall semester. Students will receive information about this through their Eastern EIU email. Students who do not complete all 3 classes will have an administrative hold placed on their student accounts, which will prevent them from being able to register for new classes. They will be prevented from dropping classes. Unlike the immunization compliance mandate, there are no financial penalties for students who do not complete the 3 programs. Of important note, student athletes also have a separate sexual assault program for athletes that they must also complete. In the past, student athletes completed one but not the other, thought that they had completed both mandates, and then were surprised to find out that they still had an additional program that they needed to complete regarding sexual assault and sexual violence. As students and families prepare for entry into the higher education environment, there are several aspects and several items that we've observed that would be very helpful for our incoming students to know, and conversations for families to have with those students. Often, when a student comes to the medical clinic, it's the beginning of a new relationship. Sometimes the providers that they prefer to see are not available due to being gone on vacation and they have to see another provider. Often, there is a lack of understanding and knowledge of a student's individual and family history. Without parents being present, when asked about individual and family health history, students are often unable to fill in the gaps and the holes that a parent who might be accompanying a younger student would normally provide. Make sure that your students know their individual health history, major illnesses, major injuries, major health impacts, as well as history and happenings of the health of the larger family. For example, if high blood pressure runs and is prevalent in your family, it's important for the student to know that and be able to articulate that. For many of us, when we go see our doctor, part of the initial beginning steps of the visit are recounting and acknowledging the medications that we're currently taking. When I go see my doctor, that's all within an electronic medical record, and I just have to simply say yes or no. While Eastern Illinois University's medical clinic does have an EMR, the first time that a student comes to see us, that information will not be available. Thus, it'll be important for the student to be able to list and describe medications that they're currently taking, as well as medications that they may have taken in the past. If a student needs to go off campus, it'll be important for them to provide that information to an off-campus provider as well. So make sure that students have listed and are able to describe the medications that they're being taken, whether it be written down on a piece of paper, put in a phone, or somewhere else that they can easily access during a medical visit. When students get sick or become ill, it's important for them to be able to articulate what is going on so that way the provider can have as much information as needed to try to make a diagnosis. Students should be strongly encouraged to write down the signs and symptoms and characteristics of their illness or the issues that they're experiencing. Even more importantly is the ability to be able to describe when those signs, those symptoms, and those characteristics originated. Was it a day ago? Was it 2 days ago? Was it a week ago? It's important to be very specific. When a student is asked and responds a couple of days, while most people might assume a couple of days to be 2 days, we've found that when students say a couple of days, it could range from a few hours to a week or two. If students are also taking over-the-counter meds to address any illness or sickness that they have, it's important that they be able to describe those meds that they've taken and provide that information to their provider. One of the things that we encourage families to discuss with their students is the use of over-the-counter meds. What over-the-counter meds have typically worked well for that student, and instructions on how not to overuse over-the-counter meds. We've also found that many students do not possess thermometers during their time on campus, and even those that do aren't necessarily certain how to take their temperature using a thermometer. Make sure your students have a thermometer and make sure that they know how to properly use it. Every year during flu season, we will have students come to the clinic saying that they have the flu. And when we ask them how they know they have the flu, they say they have a fever. And when we ask them how they know they have a fever, they're not able to give us a temperature, but they simply say, well, I put my hand to my forehead and my forehead was hot. When we ask why they didn't use a thermometer, they'll say, well, I didn't have one. Or if they do have one, they're not necessarily certain how to use it. We also recommend that you consider buying a first aid kit for your student. Or if you are a student, bringing a first aid kit and knowing what's in it, and knowing how to use those items. Regarding our medical clinic, currently, due to COVID, we are only making appointments by phone. So if you need to seek medical care and assistance from our medical clinic, you're strongly encouraged to call us by telephone. It's also important to know where we're at prior to getting sick. The last thing a student wants to try to do is figure out where the medical clinic is on campus if they're not feeling well. The last thing to know in a conversation to have is what happens when a student gets sick after hours. Our medical clinic is open typically from 8 to 5 Monday through Friday. Our counseling clinic is typically open from 8 to 4:30 Monday through Friday. If a student gets physically sick after hours, if it's something that's not very severe and can wait until the next day, they can do that and then contact us for an appointment. If it is a critical emergency, they should probably call EMS and be transported to the hospital to the local emergency department. If it's somewhere in between, there are 2 local hospital systems that do have urgent care hours until 8 p.m. every day of the week. That might be an option for your student. In those cases, your primary insurance would come into play, or you may have to pay out of pocket, as those facilities are not related to the university. It's also important that we talk about student confidentiality, particularly with parents. Up to this point in time in a student's life, particularly for those incoming freshmen, parents have often been very involved and instrumental in a student's healthcare. When a student typically has gone to see a doctor or a nurse practitioner, many times a parent has gone along with them. The parent is used to being asked questions. The parent is used to asking questions and getting information. Well, with many of the state and federal confidentiality laws, if a student is over the age of 18, we're not able to release information from the medical or the counseling chart to parents because the student owns that chart and maintains confidentiality. If a parent were to call either the medical clinic or the counseling clinic to say, I was calling to see if my student was actually accessing care and had been visiting your clinic, the medical staff and the counseling staff are likely to neither deny nor confirm that the student had been to either of the 2 clinics. Legally, we cannot open the chart and tell you what is in the chart unless the student signs a consent of release of information. What we would like to say is that we are available for consultation. So if you have concerns about your student, if you have concerns about another student, a friend who is a student, you're more than welcome to call our counseling clinic and our medical clinic, and we would be more than happy to listen to the concerns that you have, assist you in brainstorming ways of addressing those concerns, helping refer the student to help through our services. But for us to be able to actually provide you actual information such as diagnoses, treatment methods, treatment processes, medications, those types of things, if the student is over 18, we will have to have that consent for release of information. Now, typically, I usually will get some parent who says, but I'm paying for my student's tuition. I should be entitled to that information. I understand that sentiment. I understand as a parent why you would believe that you would want to have access to that information. But again, we are 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 held to federal and state confidentiality laws, and the only way that we can open up a chart and talk to you about certain elements, if not the entire chart, is to have that information. Lastly, I would encourage both students and families to have conversations about this issue. Talk about the need to have information, the need for information to be shared, desires of why that information is to be shared, and make some decisions jointly prior to coming to campus. We've seen students who have come in with a parent in tow. The parent more or less has the student sign the confidentiality form and the release of information. And then the next day after the parent has left campus, the student comes back in and either ask us to renege the consent for release of information, or they modified it saying, well, you can talk to parents about this, but don't talk to parents about that. And whatever is in the form is what we actually have to abide by. I'd also like to talk a little bit about illness in academics. When students come to the medical clinic, we typically do not give out excuses. If there is a minor illness or a routine procedure that we're performing, and if the student requests it, we will give them a verification of visit, which basically says that the student was at the clinic on this day, on this date, at this time. And it really doesn't describe very much else. If a student comes with a more moderate illness and the provider believes that the student needs to stay at home and rest for a few days, they will provide documentation, but it's important to realize that that documentation really is more of a recommendation. And I'll talk about why it's a recommendation rather than an order in terms of academics. If there's a major illness which requires hospitalization or requires the student to be sent home, or if the student needs to quarantine or isolate, then typically the medical clinic will send a brief notice electronically to all the student's faculty. If there's a major medical incident, particularly something that is off campus, we often need some kind of verification, whether it be from a treatment provider. So then we can also send a brief notice to the student's faculty. Some families and some students may say, well, if the doctor orders me to stay at home, why shouldn't I be excused? Faculty have the responsibility for determining what they will and what they will not accept as an excuse for their academic courses. And one thing that you may end up finding is that faculty have different standards and expectations regarding illness, documentation, and academics. You may have one faculty member who sits there and says all absences are okay. I'm not going to provide penalty for classes that are missed. And you may have other faculty who will sit there and not tolerate any absences whatsoever. And in between, you may find some faculty who will have positive points for attendance and other faculty who will deduct points, if not letter grades, for absences. Some faculty may say, I will give you 1 or 2 excused absences and I don't need to know what they're about. But that third absence is a letter grade. Students need to read and understand their faculty requirements and their expectations regarding illness and illness documentation. And when a student is sick, it is the student's responsibility to communicate that to a faculty member when and if at all possible. And then to also contact the faculty member to find out what possible accommodations may be made to the student during that period of absence. Being that we are in a season of COVID, faculty are being encouraged to excuse students who are isolating as a result of COVID-19 illness or quarantining as a result of being exposed to COVID-19. When students are sick and unable to attend classes due to COVID, faculty are being encouraged to provide alternative formats of instruction, such as podcast, online video recording of lectures, voiced over PowerPoints, so that those unable to attend class won't miss the academic instruction. If a student has COVID-19 or is required to quarantine by health and counseling services, we will verify that and we will send a notice to the student's faculty, basically letting them know that they will not be at class for a particular amount of time due to COVID. If a student is verified or diagnosed by an outside provider, we ask for some form of documentation be sent to us so that way we may verify that the student indeed has COVID-19 illness or must quarantine before we send that notice to faculty. Here you'll see a picture of the Human Services building, which is the building where both our medical clinic and our counseling clinic are housed. You will see that it is on the south quad. So for those students living in Thomas, Andrews, Lawson, and Taylor, we're really right across the quad. For those who live in other parts of campus, it is typically a short 5 to 10 minute walk, depending upon where you are. Again, we're open from 8 to 5, Monday through Friday, and you will find our phone number and our fax on this particular slide. You're encouraged to pause and write those numbers down. Is the 581-3013 number is the number you would call to make an appointment, and the fax number is the fax number that you would use to fax in immunizations as well as have other medical records sent to us. Our medical clinic is a fairly comprehensive medical clinic. We treat primary and acute care. We also offer services related to chronic prevention. We have men's and women's health. Within our medical clinic, we have digital x-ray, we have a laboratory, we do have a pharmacy in which both on and off-campus prescriptions can be filled if those particular pharmaceuticals are in our formulary. We offer immunizations that are required for the Illinois College Immunization Act. We also provide TB screening and testing. The medical clinic is where a student would go when they're not feeling well, when they believe that they may have upper respiratory infection, when they have an injury that doesn't require urgent critical medical emergency services. We also offer some mental health, behavioral health services through our medical clinic. And as I noted earlier, we do have a health promotion unit which offers a wide variety of educational programs, social marketing, and health promotion efforts. In terms of how the medical clinic is paid for, our health system is a little bit different than what most families and students are probably used to. Our students pay a mandatory health and counseling services fee for fall 20. That fee is anticipated to be $156 a semester for students taking 12 or more semester hours. For students who are taking 1 to 11 hours, they will pay $13 an hour. So if they're taking 10 hours of class, they would pay $130 for that semester. I like to describe the health and counseling services fee kind of like a YMCA membership. That health and counseling services fee allows students to walk into the medical clinic. It allows them to see a nurse. It allows them to see a provider for primary care purposes. It subsidizes the care that the students receive. Typically, we do not have co-pays for primary care. There are some visits in which we do have co-pays. Typically, it would be psychiatric mental health, which would be a $30 copay. Men's health, women's health, I believe, is a $20 copay. You will see some other things that we charge supplementally for. We've been asked to charge for some things. to keep the cost of that semesterly fee down, rather than having a high semester fee that perhaps not everybody would take advantage of. So you'll see the cost for PAP exams and STI screenings. If a student comes in and needs a procedure or treatment, such as a wart removed, an ear wash, a suture, an ingrown toenail removed, typically there is a charge of $17.50. If a student has allergies and they need some allergy injections administered, they can pay $15 for each injection, or if they have a significant number that needs to be administered over the course of the semester, they can pay a one-time flat fee of $50. If a student's out on the quad and trips while playing football and needs to have x-rays taken, we charge $30 per injury, regardless of the number of photo slides, x-ray slides that we end up taking. If a student comes and sees a medical provider and the medical provider diagnoses them with an upper respiratory infection and wants to have some lab testing, most of our lab testing will be between $10 and $20 per lab test. So if the provider wants to have the student do 2 or 3 lab testing, you're looking really between $20 and $60 for the overall labs. If there's a venipuncture, meaning that blood has to be drawn, there's a $10 charge in addition to the lab draws. And then if a student needs some medical equipment, bracing, crutches, those types of things, we typically charge our cost, and those costs range between $5 and $25. If a student has supplemental services or supplemental things that require additional payment, they may pay for it by cash. They may pay for it by debit or credit card. They can have it billed to their university account. We do not accept third-party insurance billing. We're not able to accept outside insurance or Medicare or Medicaid cards, nor do we take checks, nor are we able to have individuals swipe their Panther card and apply debit to the account that way. We've talked about the medical clinic. Let's talk a little bit about the counseling. As many people are aware, mental health has become a primary concern of colleges and universities. We see students with anxiety, depression, relationship issues, significant trauma, substance use, disordered eating, grief, identity issues, transitional issues, and many more. We'll see students who are upset because their girlfriend broke up with them, to students that have dual diagnoses. Clinic, we mainly offer individual counseling. During the fall and spring semesters, we will also typically offer a wide variety of groups ranging from anxiety, mood disorders, grief. A lot of it depends and varies depending upon what students are presenting with. Occasionally, we will offer couples counseling. We do offer crisis counseling during the day. During every work day, there is one counselor whose time is reserved to provide crisis counseling and intervention for students who walk in or call in. And then we also do a lot of consultation in the counseling clinic, talking with parents, talking with faculty members, talking with staff members who have concerns over particular students, and we'll typically listen to what information is provided to us. We will try to brainstorm ways to offer assistance to that student and get the student the help that they need, as well as provide some insights on how loved ones and those who are concerned can handle the situation. The nice thing about the health and counseling clinic is that services are available free to registered students. There's no additional payment required. The only fee that the counseling clinic charges would be for those students who no-show or cancel late. This again provides an overview of our hours and our phone numbers. You'll see an after-hours crisis number. As previously mentioned, after-hours crisis is available to our students. When our counseling clinic is not open, we have a relationship with LifeLinks Mental Health Center, which is our county mental health agency, to provide after-hours telephone crisis and, if needed, in-person in-person crisis intervention to our students. Students may access the after-hours crisis either by contacting our counseling clinic phone number directly, and they'll be transferred to LifeLinks, or they can directly call their hotline, which is 1-866-567-2400. For our students who live in the residence halls, professional staff are live in addition to the student resident assistants. So if a student ends up having a crisis, even if we're open, often residence hall professional staff get involved and are able to provide support and assistance, and then make an appropriate referral to our counseling clinic during daytime hours, or help the student access the after hours crisis hotline. Some situations may warrant a need for local emergency services to be called to campus. Our nearby fire station, which provides EMS services, are really only about 3 to 5 minutes away in terms of a call response time. And if they come to campus, they will typically assess a student, make a determination whether it's safe for the student to stay on campus, or if needed, be transported to Sarah Bush Lincoln Health Systems Emergency Department Behavioral Health Units. This program is available through the new student and family program orientation. Here are some dates and times. This presentation is also available through the EIU Medical Clinic webpage. Student insurance is part of health and counseling services. It is located in a different building than the medical clinic and the counseling clinic. It is located in the student services building, which is the building where financial aid and Panther Card services reside. They are typically open from 8 in the morning to 5 in the evening, Monday through Friday during the fall and spring semesters. Student insurance is a supplemental plan of medical coverage for injury and illness. It will typically coordinate as a second payer, with the student's primary insurance being the primary payer. We will typically have a $100 deductible per diagnosis, and we'll pay up to 70% of eligible expenses, and there's an annual maximum of $15,000. Student insurance works really anywhere. There is no network, but it is mainly intended for off-campus care related to emergency room, emergency department visits, or specialty care referrals that we're not able to provide on campus. Student insurance is delivering its own presentation during the new student and family program orientation. Here are some dates. If you are interested and are a new student, contact student and family programs regarding their orientation schedules and how you may be able to sign up for that program. The student insurance subunit has also created recordings that are available on their website that you may wish to look at your convenience. If you've not been to our websites, I would encourage you to go to our medical clinic, our counseling clinic, and our student insurance websites. They're chock full of information and links and resources that you will find very beneficial and very useful. It's always great to look them over before you have a need of our services. And with that, we would continue to encourage you to check us out, and for your students to take advantage of our great resources. And thank you for helping us maintain a healthy campus community. Thank you.